Hi, and welcome to the Healthcare Radio's podcast. Today we have with us Aditya Sharma, who is the CEO of AffordPlan. Let me begin with asking your opinion on the National Digital Health Mission and how it is going to benefit the Indian healthcare system.
See, I think any initiative that is geared towards enabling records to be made available, uh, or any such initiative is something that I think overall everybody welcomes. And I have been in close touch with some of the people who are in the forefront and driving it as far as government of India is concerned. And I think it's fairly ambitious, and if there is a country that can pull it off, that is India, because we have all the tech resources. So I have only good things to say about all of these things. Second, it brings in more transparency, more clarity, uh, and will help faster decision making. You don't have to run all over the place looking for your records. And I think there's a fair amount of flexibility built into the system, which allows you to ensure that some of it, which limits actually the abuse. So we'll see how the implementation works, but the intent is in the right place.
You mentioned about the opportunities of having an health card in India, both for for the patient and the hospital. Could you elaborate on that, please?
So we work with two objectives, but even before that, where is it that we come from? Personally, I am of the view that if India has to move some of the matrices that are indicative of human growth index, will have to move. And that doesn't mean launching another burger brand or a denim brand. I think we have enough of those. What really matters is uh, areas like drinking water, sanitization, controlled use of fertilizers, most definitely education for all, and healthcare. Uh, so we decided to pursue this opportunity, keeping in mind that access to good health is something that is only for the privileged few. And the biggest restriction or the limitation to that is the fact that it is perceived to be expensive. It is actually very expensive. Insurance will always be for the privileged few, for the chosen few. So our job was to bring uh, both sides of the aisle closer. On one hand, you have healthcare providers, some of whom are doing some fantastic work, and on the other hand, you have large population of India which is being exposed to all sorts of diseases, whether it's cardiac or diabetes or cancer. We are the capital of all. And with the level of pollution we have in the air, 100% we're going to have lung disease as well. So while the average life span has gone up in India, if you compare it with the 70s and the 60s, the quality of life has deteriorated, and it has resulted in heavy outgo of medical expenses. Retail inflation for healthcare expenses, I think, is upwards of 12 to 13%. You have additional supplements that are kicking in, lifestyle diseases that are kicking in earlier. Through a card, what we try and do is build affordability for patients. We try and minimize their costs, give them opportunities to engage in financial instruments like microinsurance, which helps people who don't have a full-fledged healthcare insurance policy. We try and work with partners to ensure we can give them loans so that their working capital needs can be taken care of. It's a big motivation for us. In our own company, we have people who have lost parents to expensive diseases, and parents who chose not to get treated, but they let cancer ravage their bodies for only one reason, that they didn't want to leave their next generation in debt. And that is a very powerful motivator. And to do that, you have to ensure that the healthcare providers are also getting certain advantages, and we work hence closely with both sides. And the card is one of our first products, but not the only product. It has multiple features loaded into it. You can save, you can opt for insurance, you can go in for loans, you can hospitals can extend cashbacks, You can take it to your entire family. You can introduce your neighbors to it, uh, and as a result of which benefit the whole society.
So you're saying that the health card will be much more than an health insurance.
Insurance is just one part of it. We have two micro insurance, so there's a difference between insurance and micro insurance. Whereas an insurance is, something that you have to pay regular. Micro insurance is something that covers very specific areas, and it gives you relief. So, in addition to insurance, people have the option of saving for a elective or a planned surgery. They have the option of, if they are strapped for cash, they can apply for a loan. We work with a large number of NBFCs and other lenders at the back end, and we try and ensure that as many of these people can get a loan. It's all geared to reduce the health savings for a person by around 15 to 20%. With some other products, maybe we might be able to do more.
Okay. With COVID and the associated difficulties that we are seeing right now, we have seen that financial planning is very important when it comes to health matters. So, post COVID, how do you think the health card can benefit people? In the sense, what I mean to say is, right now there are people who are not electing for certain kind of, like you say, the elective surgery, or the people with comorbidities not going for certain kind of treatments. How can we ensure that the financial planning can help everyone, whether it is from people from the urban area or from the rural area? How is it important for people post COVID?
See, it's equally important for people post COVID as it was for people pre COVID. Nothing changes. Our product is not something where somebody is supposed to save money. It's against the natural thought process, at least in India. Even though we are, and we are a very fatalistic society. That's written in my fate, and you will see people save money for every occasion. They get excited even if they have to take a holiday now, and go abroad for a holiday. They'll save for that. But ask anybody who whether they'll save for money, and they'll say, "Why should I think? I need to think positive." So what if both parents have got diabetes, and you are pre-diabetic? So nothing is going to change, and we don't intend to create a product which, first of all, requires some kind of change in the behavior of customers. That would be sheer madness. So what we've done is that as and when you are detected with something, you have the possibility of engaging with our product. So it's designed for people who are in the midst of getting a treatment, and not for people who have to plan for a surgery ahead. And at that moment, the need does not arise. We don't think anything is going to change pre-COVID or post-COVID. The governments that have actually succeeded in doing something like this and making people responsible for their own health are, I think, there's Singapore for sure, which incentivizes you to save for healthcare and gives you some tax benefits, because ultimately large number of people either dying young or having to incur these kind of expenditures is actually a drain on the GDP. And in addition to that, it hits the insurance companies. It's a cycle, which means that the insurance companies will also have to increase premium. Uh, the best way is to have a healthy society. And to do that, the best way is not just to be curative, but also to be preventive. And that's something we want to explore in some time, where people are aware, we are very educated, and the number of people who are literate is going up every year. But look at the food habits, look at our ability to exercise, look at the kind of risks we take with our health. We must be amongst the least concerned, despite having all the education and all the technology. So I don't think anything much is going to change. We will continue to roll out products so that as people understand that they may have to incur some expenses, they can use the card and bring it down.
How can we achieve healthcare parity? When we are talking about future of healthcare, when we are talking about digital healthcare, we are talking about accessibility to high quality healthcare, even to the rarest of the rural areas. How do we get that parity in actual? What are your views on that?
Very difficult. So for many years, I tried to, when I was working in the VC space, I tried to invest in companies that were doing some good work in the semi-urban area. It's almost impossible. And that's the way our country is structured. Till some time back, it was only in large cities that you saw advanced healthcare. It's now last 10, 15 years, I'm seeing some people now who've been educated in large cities are going back to their to small towns if they came from small towns because they feel they want to go back home. Parents are aging. Some of them also feel it's their duty. But beyond that, if you go, very difficult. There are certain clusters that emerge. So in rural Uttarakhand or Uttar Pradesh, you will see suddenly one town which has a lot of healthcare facilities. It's just a cluster which has emerged by accident. I think this requires some degree of vision from the Medical Council of India to sit down with the government of India and chart out a 5-year course as to how do you at least ensure that at village and taluk level there is at least primary healthcare which is available. There should be at least a basic X-ray, which should be able to work even if there is no electricity. We have all the entrepreneurs in the world, and there are some good guys who are coming up with equipment that will help, but they don't really get funded. Government can play a big role by putting money behind certain entrepreneurs who are coming up with some of these innovative products where the reality of life is that there is still power cut happening for 6 hours. If there is power cut for 6 hours, how do you even run an X-ray machine? So I wish we could solve, or private enterprise can solve many of these problems, but it's not going to happen. It will require someone with foresight, someone who thought about the digitization of records, someone similar to come and really shake up the system. And it'll also need to come from doctors themselves. They have a role in society, not just to, treat people, but also to drive systemic change. And all it takes is one person, right? So it's hope that somebody will come and change it.
What, in your view, is the future of healthcare?
At the moment, given where we are, the future of healthcare is not looking very rosy with all the diseases that we are being hit by. Uh, so many families have been decimated. I don't even know what is the right number. I know
Mm.
for sure that I lost people in my family to COVID. One of them was a doctor. So I worry about the expenses that are going to go up. I worry how the middle class is going to handle it. It is definitely going to lead to erosion of wealth. Uh, there is some degree of awareness that is coming where people are getting fitter or are at least a little conscious. But I would say that restricted to the top 4 or 5% of the country. So I don't foresee something great happening in overall healthcare. But what I do know for a fact is that India is a land of entrepreneurs. There's a huge amount of energy, and people will keep coming up with disruptive models, and we need to find a way to be able to encourage such people. For every 90 such models, one will succeed. And the idea is, can we find the right people, back them, whether it is by private money or by government money? The answers will emerge from some of these disruptions that will happen. That's something that hopefully is good. Till some time back, not too many people were entering into healthcare. If they were, it was primarily to be on the clinical side, set up a hospital or set up a clinic. Now you are seeing very, very diverse models coming up. People are applying their mind. So that I think is the one silver lining in the cloud.
AffordPlan offers a full stack of financial services for the healthcare, including the OPD wallet, IPD savings, etc. So, could you give us an insight into the journey and about what AffordPlan can help with in terms of uh, for anyone who is looking for a financial help?
So the journey of a Ford plan. has been through evolutions. Earlier, there was a savings product which continued for a couple of years, and then we realized that the product has its own limitations. And the erstwhile founder is the person who thought that why not create something far more versatile. I used to be an investor in the company and then a consultant, and now I'm running the show. And it is through this evolutionary turn that the Swasth card came about. We are in the process of adding more features to it. We have now completed almost 1.5 years, and we've seen the benefits that have accrued to the customers as well as to the hospitals. It has brought them together closer. It has created some degree of security as far as customers are concerned. We have hospitals in areas which are close to village area or close to a rural area, and people have blessed us. Actually, they've said you're doing God's work, and that for us is a fairly powerful motivation or very powerful attraction. We will continue to find a way to bring down costs for the customers and at the same time kickstart profitability or ensure that the hospitals are able to benefit in some way or the other. Uh, at the moment, we are working with over 100 hospitals in close to 15 cities. We are adding close to 12 to 15 hospitals every month. And the idea is soon we will also be working with pharmacies and laboratories because that's another area where they need help. And we will try and roll out similar model. We also have other products for which are more for the hospital side. Maybe we'll see them after 7 or 8 months. Have I been able to answer your question, Sujat?
Last year budget gave us a lot of hopes when it came to healthcare segment. What are your expectations for this time's budget?
Look at the geography that we are in, right? I mean, it's sad. One side China, one side Pakistan, and you have to spend billions of dollars as far as arms and defense budget is concerned. Somebody sensible should talk to all three, especially Pakistan, and talk about how can you improve the quality. So I do understand that the government of India has its limitations. Uh, for us in India, healthcare continues to be a very under-penetrated category. I have I have only one request, and I'm not going to throw caution to the wind and say that look, increase the GDP spending on as a percentage of spend on healthcare. It's not likely to happen. For me, the best results happen whether you call it infrastructure, see the highways that are being built, or in any other areas where the government and the private enterprise works closely together. it's not in the it's not the business of the government to set up and run hospitals. That's not their expertise. Medical colleges maybe, but they're not known for running hospitals. It's a very specialized area. So similarly, all other areas in healthcare. So what the government should do is work actively with the private side and bridge the gap where the government becomes mainly either a sponsor or works as an arbitrator or has a role where it brings the two sides together. There is the possibility of rolling out sensible and more long lasting healthcare schemes and not just run it for popular votes. So both state and central government need to think. We have an aging population. India is no longer green, India is graying, and with every passing decade you will see a larger number of people in the 40s and the 50s and the 60s, and that is going to create a huge burden on families. So my only wish is for something to be done more proactively, where the public-private partnership kicks in and brings out the best, the healthcare, perhaps the service from the Indian side, from the private side, and the vision and thinking from the government side.
Thank you, Aditya. Thank you for throwing light into many factors that a food plan is
Thank you very
looking
much.
forward to. Yeah, look forward to hearing more and more plans from your end which can help our countrymen.